TopMedTalk.
Well, welcome. It's day 2 of the annual meeting of the American Society of Anesthesiologists, Anesthesiology 2021. We're here live in person in the exhibit hall in San Diego. And I'm Desiree Chappell, and I'm joined by my co-host, Professor Monty Mythen, Professor of Anesthesia and Critical Care at the University College London, and Editor-in-Chief of TopMedTalk. Professor, it's lovely to have you here.
Good morning, Desiree. It's wonderful to be here.
We didn't know if it was going to happen, did we?
We did not know it's happened, but it is happening, and everyone is buoyant,
yeah,
I would say.
The buzz is just fantastic. Well, Professor Sol Aronson is joining us as well.
And we're here looking at people in the flesh and real. It's just,
Yeah. It's hard to know whether to great, hug or fist bump.
Yes. Fantastic.
Well, we're here in the exhibit hall having our favorite types of conversations with live in person, talking with, very important guests, key opinion leaders, some of the presenters here during the meeting, and super excited about it. The ASA has graciously sponsored us to be here and partnered with us to have us here in the exhibit hall to have these conversations. We want to say thank you to them. Now, if you're new to TopMedTalk and have never, heard of us or been here before, Monty, let's talk about it for just a second.
So TopMedTalk we refer to as the broadcasting arm of evidence-based perioperative medicine. Evidence-based perioperative medicine is 25 years old next year. It's an international collaboration which puts on meetings, courses and conferences all about the sort of whole space of perioperative medicine, perioperative care, the perioperative surgical home type of endeavors, which went from being, a subject of some controversy 25 years ago, but now it's become completely mainstream. And TopMedTalk is our broadcasting arm. So it's all free, open access medical education coming out primarily as podcasts. We can go into greater detail, but that's the sort of thumbnail sketch.
Yeah. We'll catch up on how to get all that content at the end. Without further ado, though, I would love to introduce our guest today, Dr. Adam Stryker. Hello, Adam. How are you doing?
Hi, I'm doing well. Thank you very much.
Good. Excited to be here.
Oh, yeah, absolutely. Yep.
In person, for sure.
Yeah. No, in person's great. I love seeing everybody, and this is going to be a great opportunity to just have a conversation about some things. So.
Well, Adam, for everyone listening today or watching, tell us a little bit more about yourself.
Well, I am currently practicing. I'm an associate professor of anesthesiology at the University of Kentucky and associate professor of clinical anesthesia at the University of Cincinnati, and I'm part of the Division of Cardiac Anesthesia at Cincinnati Children's Hospital, and primarily part of the joint pediatric cardiac program between University of Kentucky and Cincinnati Children's. And so primarily work in Lexington, and just recently started in that position. Prior to this, I was in Kansas City for many years.
Fantastic.
And originally from Minnesota, though.
Boy,
so
that covers...
I'm kind of for some reason, I just can't get out of the Midwest.
Can't get out of the Midwest.
Kentucky is pushing the boundaries, I think, but yeah.
Many zip codes are represented there.
Yeah,
no, that's
exactly.
good. So pediatric cardiac anesthesia?
I do solely pediatric anesthesia, occasionally adult congenital cardiac anesthesia as part of this program, but my focus is pediatric and pediatric cardiac anesthesia.
Fantastic. So you're also on the ASA Committee on Communication. So tell us a little bit about that committee.
Well, the Committee on Communications is tasked in general with making sure, not only taking care of the messaging to the public about what it is anesthesiologists do and the value we bring to patient care, but also shaping that message and creating messages, evaluating ideas, figuring out how best to affect that messaging. And it's a robust committee made up of a number of individuals around the country, different backgrounds, both culturally as well as practice backgrounds from practices, academic, private practice, and so we've got a diversity of opinion and thought, and it really makes for a successful forum to come up with what we think is the optimum way to get the message out to everybody that needs to know about who anesthesiologists are and what it is we do.
So Desiree, if I may add, I'm a long-term member of the ASA, but as we talked about setting down at the beginning, I live and work in the United Kingdom, in England, although I did work at Duke in the past. our experience with COVID-19 has been that suddenly everyone knows what we do or who we are. Has it been the same here?
Oh, absolutely. It's afforded us an opportunity to try to take advantage because anesthesiologists, as you know, across the world have stepped up out of need, but out of the desire to be at the forefront of taking care of patients during this pandemic. And all of a sudden, people do now know who we are. And it's specifically afforded our committee the opportunity to try to alter how we're going to shape that message, because we're doing it. We're doing that work. We're out there helping people. Yeah. We need people to know about it, though, because this is a specialty that hasn't always been at the forefront of everyone's mind.
So Adam, I appreciate that the people in the hospital certainly understand who's going to be in the front of the line to manage those patients that are most in need. How are we communicating that to the public? How are we representing our, purpose and value and place to the public who has traditionally known about anesthesiology as that person behind the mask?
Well, it's a great question, and it's a great opportunity for me to bring up what we have started, which is called our Made for This Moment awareness campaign. And this is a campaign we have embarked upon with the American Society of Anesthesiologists, and specifically coming out of the Committee on Communications as a broad strategic campaign to accomplish just that, to get the message out to the public. Now, the public is a broad category that includes, more specifically, policymakers, healthcare executives, patients, everyone, so that they know who it is, what it is we do, and who we are. And this campaign is designed specifically for that. Up until this point, we haven't really done a great job of that. I mean, it's commendable for us as physicians and anesthesiologists that we want to be the unsung heroes, if you will, in the hospital or the ICUs or clinics. We don't look for self-gratification, but it's incumbent upon us at this time to get this message out. It's important that people know who we are, the value we bring, because fundamentally we care about what happens to our patients, and we need other people that affect policy. We need the public to know that we bring these skills, we have this expertise, and we need to be available to take care of those patients. So this campaign was started a couple of years ago. We did research was done to kind of guide us on how we want to approach things, but fundamentally the campaign is about getting the message out to everyone who it is or who we are and what it is we do. That's fundamentally. More specifically, tackles or highlights our education, our expertise, the skills we bring. And why is it called Made for This Moment? Because
Adam, why is it called Made for This Moment?
I'm anticipating the question right there. I know that question's out there.
You've done this a couple times.
Made for This Moment is because we believe that not only the campaign is going to show how we're made for this moment, these moments, we believe anesthesiologists are made for the moments that matter to patients, whether that's delivering quality of care, whether that's advocating on a public health scale for the benefit of our patients, whether it's driving innovation in healthcare, which we do constantly, and more specifically, and of recent note, how we step up to lead during a unprecedented global pandemic.
Yeah.
When the bell rang, we got up.
Yeah, absolutely.
That's right. Talk to us a little bit about how the campaign is working, some of the different, kind of specific outreaches.
Well, so the campaign is launched in stages, if you will. We wanted to get the broad strokes out initially. A number of years ago, research showed that the public, a vast majority of public, about 6 out of 10 from a few years back, did not know that anesthesiologists were physicians. Now, a lot of us have grown to believe that a lot of the public, based on your question earlier, does not know who we are. But we wanted some more recent research to sort of target, to allow us to target where those specific pockets were. Mm-hmm. And so research was performed back in late 2019 up through early 2020. This was before the pandemic. Several months long, different stakeholders, if you will, different groups, which confirmed a lot of our fears or suspicions about the lack of awareness. And so the campaign itself has a multi-pronged approach to try to target that message to different individuals, healthcare executives, policymakers, the public, and patients. Those are the people we want to get to, because obviously the patients, they need them to know who's taking care of them. We need them to. The research shows that the vast majority of the public wants physicians involved in their anesthetic care. They need to know that that is the case. Policymakers who are concerned about their constituents and access to health care need to know that we can't sacrifice any level of care when it comes to providing that, and they need to know that any policies they make are going to potentially affect the access to anesthesiologists or the involvement of anesthesiologists, and healthcare executives are looking to drive costs down. They're trying to make healthcare accessible too at the local level. Well, they need to know that hospital policies need to account for the safe care that we give, the quality of care we give. They need to know that there is a difference.
You know, when it comes to like young physicians, young doctors, and getting that out, the message out to them, I mean, that's really important to share that as well.
Absolutely. No, certainly. Young doctors, the vast majority of physicians, everybody I've ever talked to that's young, old, they went into physicians because of a calling. They wanted to help patients. That's a cliche time and time again. Like, what are you going to write in your essay to get into medical school? I want to help patients.
Yeah.
Well, everybody wants to help people. We get that. But really fundamentally, when you talk to physicians throughout their course of training, that's what they want to do. So young physicians, they want to know that they are going to have the opportunity to be able to deliver that. They want to be able to help patients in a way they believe is truly impactful. They know that they can help, and we need to provide that that atmosphere for them. We need them to know that we believe in our younger physicians. We believe in the future of anesthesia care, and that the future is going to be there to allow them to practice medicine the way we all believe it should be practiced.
So if people are looking for information, or anesthesiologists want to find out more ways to get involved, and then also to share all the output that you guys have been developing, where are some of the best places to find that?
Well, if you're here we're at the annual meeting of anesthesiology, the American Society of Anesthesiologists here in San Diego. The Resource Center, which is actually in the hall we're in, has all the material you could possibly want. And you can stop by that kiosk in person. There's printed materials. Obviously, we have online materials as well.
Yeah.
And we have, the website is asahq.org/ I'm going to hopefully get this right. MFTM's -members.
That's right.
Everything that we have printed at the kiosk, you can get online, you can download. There is, the important thing about this campaign, it all sounds great on paper. We want to get our message out.
Yeah.
Well, there's a lot of solid fundamental suggestions and tactics, strategies, suggestions, and that a variety of individuals and practices can sink their teeth into.
Yeah.
And those things are all available. This weekend we're launching something called the Enhanced Patient Communication Program. Now, this is a subset of the Made for This Moment campaign. It's easy to say we need to get the message out, but there's a lot of our members that are concerned that we ourselves are not doing the job we need to do at the bedside. This program specifically gives suggestions and allows for a robust set of guidelines to help anybody enhance the communications at the bedside. The idea is we want patients to remember who we are. We're taking care of them. They need to know that. And so this set of there's a subgroup did a fantastic job putting this together, and a lot of great suggestions on how we can best, in the limited amount of time we have with our patients, affect communications. And that's been shown to increase value, increase help with decrease safety issues with patients, or increase patient outcomes.
Patient experience, I'm sure.
Satisfaction scores are improved. So all these modalities are accomplished by better communications at the bedside.
Adam, one of the things that I'm thinking about, first of all, I enjoy your passion. It's just oozing, from you. So well done.
Well, thanks.
You should go into communications or something.
That's right. That's right.
One of the questions I'm asking myself as I hear you speak about the things that you're doing to enhance that messaging is within the health system, we get our feedback. A metric of feedback is an HCAP, that some, albeit high level, indicator of satisfaction through the patient's lens. But it represents the experience between anesthesiology and the patient, unless you have a pain physician that's encountering with you. How can we invite the patients to speak more directly through those post-event encounter surveys about their experience with their anesthesiologist?
Well, that's a great question. Part of this campaign is to we want to target messaging to healthcare executives and C-suite individuals. They need to know that we are providing quality care and providing safe care, and they need to know who we are. And a third of healthcare executives do not have expressed indifference. They do not care. They say it does not matter whether an anesthesiologist or a non-physician is present during an anesthetic to handle complications, medical complications, or emergencies. That's a disturbing stat. They need to know who we are and that we're there. And my point is, to answer your question, is that we need to partner with healthcare executives. We need to ally with them so that we can have mechanisms in place to allow patients to give feedback about their perioperative experience. Those have to be in place. It's not simply global satisfaction scores. We need more specific metrics, more specific avenues to allow for patients to deliver that feedback. We want the public to ask if they know that the vast majority of research shows that the public wants physicians involved in their anesthetic care. They need to have the mechanisms to explain that to their hospitals, their organizations, the healthcare system that they are a part of. And so this hopefully, when they realize who's taking care of them, they're like, next time I want a physician anesthesiologist involved in my care. How do I go about that? Well, I'm going to make sure to let the healthcare system know that's the case.
Adam, having been involved on my side of the water, the UK side of it, in sort of national endeavours with regards to the extended role of the anesthesiologists, we call ourselves anaesthetists. The first attempt to do that, we hadn't completed the internal communication. Yeah. So we'd gone to communicate externally in anticipation that the whole of our community would believe what we were communicating as the sort of national body. And that fell over a little bit because we hadn't completed internal communications. Are you confident you've closed out the internal communications?
No, we are not. No, that's also part of the strategy.
Great,
that is a huge nidus for the enhanced patient communication program. It's not simply that we believe that's going to help the public understand who we are. We have members asking for this, a couple years back.
How do we show our value to these?
Right, they're like, I've gotten email messages over the years of members asking, they're like, yeah, this is great to tell policymakers that we're better than anybody else and that we're necessary, but I want, at the bedside, I see people all the time not doing what we should be doing. How do we affect this fundamental change that way? Well, this program is designed to give tools to people so that they can actually improve that. They can make suggestions to their colleagues, to residents, to trainees, how best to actually change how we're communicating at the patient level. Ergo, that will fundamentally help the communication internally. I think it will drive the idea that we are listening to our members as well, and we're targeting our members as well by saying this isn't just fluff. We actually want you to do something different. We need to be better ourselves. That, to me, is a key piece of the communication internally. But we have a lot of work to do on that front too, and that is not lost at all.
It's all about inspiring change for
absolutely.
which is, we know hard to do, but sounds like you guys are doing great. So one more time for everyone that's listening, resources again for anything that anybody needs to find, and are there social media accounts, and things like that?
Well, the ASA Lifeline
is the best
Twitter
place.
account. That's a great one. You can find Facebook, Instagram, the ASA. That's usually the best place for any of these ASA materials. We don't have a specific account for communications, but the Made for This Moment campaign can be found at any of those ASA sites. But I think you're going to get the best bang for your buck by visiting the site itself, the website, because it has all ability to download all those materials that we talked about if you can't get them in person. And I don't know how many people want printed materials now anyway. But you follow the ASA on all your favorite social media accounts, and that's the best way to access the these things. So.
Adam, thank you so much for taking the time out of, I'm sure, a very busy schedule.
No worry. I really appreciate the opportunity to talk about this. I'm excited about this. Yeah. I hope people know about it. Communication, everybody thinks it's not a big deal. We talk to our patients all the time, no problem. But there really, when you delve into it, there really is some important there's some important substance there. There's some important ways to make some changes. And everybody can improve their interaction with patients and policymakers. And so I hope everybody just takes a minute to take a look, and I think they'll find that there's some valuable resources there. So thank you guys very much for allowing me the opportunity to talk to you
our
today.
pleasure. Your passion has come through.
It is. It's great.
Yeah.
Thank you, Adam.
Thank you so much. Well, thanks for listening to TopMedTalk or watching wherever you are in the world. We really appreciate it. Monty, make sure everyone knows how to get to the other content that we have.
So when you're in our education hub, which is where you're watching this at the moment, if you look around, you'll see that there are other places you can delve into. There's upcoming meetings, but in particular the on-demand component of it, where there's all of our meetings and all of this content will be there. There's also selection of podcasts, so please do enjoy. If you really want to go after everything, you'll get over 1,500 different opportunities.
Over 1,500 pods. Yeah, lots of content. You can always find us on your favorite podcatcher too. TopMedTalk. Thanks so much for listening.
And it's free. Completely free.
Free. Monty, you communicated that well.
Thank you, Sol.
You're welcome.
We're communicators. Thanks for watching. Cheers.
Thank you.
Thanks, everyone.
TopMedTalk.
Thanks for downloading TopMedTalk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, TopMedTalk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.